Hello, everyone. Happy Friday. I'm Rundy Murphy. It's October 2nd, Friday, October 2nd. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. I'm here to give you the update on COVID-19 pandemic as it affects Mobile County. First, let me say that we had a little celebration on the historical steps of the Keeler Building downtown at our health department today. Today is National DIS Recognition Day. DIS stands for Disease Intervention Specialist. These are the public health superheroes who investigate cases of communicable disease and follow up on their contacts to try to slow the spread of communicable disease transmission in our communities. And so we celebrated with a group picture. Hopefully you'll maybe see some of that on our website later, on Facebook, or maybe on the news later tonight. So counts of COVID around the world. So globally, 34,375,000 cases of COVID-19 with over 1 million deaths. I mean, such an enormous milestone in crossing that 1 million deaths from COVID-19 worldwide. In the U.S., we've had 7.2 million cases with 208,000 deaths. In Alabama today, earlier this morning, reporting on almost 157,000 deaths with 156,698 cases. So just over 150,000 cases with 2,550 deaths. So in Mobile County today, Mobile County residents were reporting on 13,680 COVID-19 cases. Yesterday we added 79. That was a low for this week. Sunday we had a really low number, but Monday 51, Tuesday 57, Wednesday 75, and today back down again. We are seeing some sort of fluctuations in our count because we have had a new lab come on this week. Then we know that there is some transition from PCR testing to rapid testing. We'll talk more about that in a minute. So we'll see those numbers bounce up and down. But again, in general, our case count is starting to creep up slightly. So we're reporting 297 deaths. That's an increase of 0. Cumulative number of people hospitalized in Mobile hospitals with COVID-19 is just over 2,047. That was flat from yesterday. And then the average yesterday, the number of people in the hospital with COVID-19 was at 71. So again, the number of patients hospitalized with COVID-19 is also starting to creep up a little bit, whereas last week we were averaging, and the week before, sort of in the mid 60s range. Now we've been up in the 70s every day this week. So we'll continue to keep a close eye on those figures. Another indicator that we talk about on Friday that is updated by the Alabama Department of Public Health is the risk indicator dashboard. This is also now, for the past couple of weeks, we had been in a green status and a low risk status, but we are now classified in a high status. So a high risk status based on the number of cases, based on the number of hospitalizations and death, based on the percent of laboratory results that are positive, and based on the percentage of emergency department visits that are due for COVID-like illness. So all of those indicators, most of them we're doing pretty well, but it's all of them together that decides what risk category we're in, and we are now in the high risk category for COVID. So more reasons to continue to emphasize the safer at home order. You may have seen Governor Ivey and Dr. Harris announced yesterday a minor modification, a minor but really important modification to the safer at home order. So for all other things, the order, the mask mandate, the no non-work gatherings, the physical distancing, limits on the number of patrons and those sorts of things have stayed the same, but extended through November 8th. November 8th at 5 p.m. The minor but important change is that now at hospitals and similar institutions, this is Section 17 of the order, All hospitals, nursing home, long-term care facilities, which include assisted living, specialty care, assisted living, now each patient or resident may be accompanied by one caregiver at a time in the case of a hospital, or receive visits from one visitor at a time in the case of nursing home and long-term care facilities. So this is really good news for patients and for families that have not been able to visit with their loved ones for a very long time. One guest or visitor or family member at a time, and then you have to comply with the screening or entry proceedings for those facilities. So they still have a great need to try to control the introduction of COVID in those facilities to try to protect the staff and the residents to the greatest extent possible, especially the residents. So they expect if you enter a nursing home or you want to, that you're going to have to answer some questions, maybe get your your fever measured, probably wear a mask and some other things. So just please, we're super happy that families will be reunited with their loved ones. But please follow the advice and guidance of the facilities where they are, the hospitals and the facilities. So let me make sure there's an FAQ on the governor's order. Let me just make sure that I have. If you have questions about what the guidance is, it's here. So let's see. Yeah, huge emphasis on just one person. All right, I am going to move on. All right, couple of questions to answer from the folks at Fox. So the first question, you may have seen on the news today, there's a press conference that the president and the first lady have tested positive for COVID-19. And the question here is, for months, doctors have been saying everyone will get COVID. I assume it's not much a surprise that President Trump got it, but is there a concern because of his age? Yes, anyone who gets COVID who is, 65 or older, or who has underlying medical conditions is at risk of severe complication and death from COVID-19. And I want to just review what, an underlying medical condition means. Any people at any age are at risk if you have cancer, chronic kidney disease, COPD, if your immune system is weakened, like from an organ transplant, for example, if you are obese, so if you have a BMI index of 30 or higher, if you have serious heart conditions such as heart failure, coronary artery, or cardiomyopathies, if you have sickle cell disease, and if you have type 2 diabetes. So if you are any age and you have those conditions, you are at risk of severe illness for COVID-19. Anyone over the age of 65 is at risk for severe illness of COVID-19, including the president. The next question is, with such a high-profile person getting COVID-19, is it a good reminder that the virus is still out there? I hope no one needs to be reminded that the virus is still out there. COVID-19 is still with us. We are still very much in the throes of a global pandemic of an infectious viral agent that was unknown to us a year ago. We're all in like one huge scientific experiment, learning as we go along, and is very much still a clear and present danger to everyone. Yes, people who are young and do not have underlying medical conditions may have mild infections. They may be symptomatic. A large proportion of younger people will not have symptoms. So good for you. If you're in that age category, if you get COVID, 98% of us are going to survive. The death rate is down around 2%. But the virus can still cause severe complications, severe illness in people who are older and have significant health issues that I mentioned just a minute ago. As we move into fall, flu season and COVID is a concern. What should people do now? Yes, so traditionally, the first full week of October, which is next week, kicks off seasonal influenza season. And we are starting to see messages about get a flu shot as quickly as you can, as early as you can, get a flu shot. If your pharmacy or doctor's office has flu vaccine right now, get the shot. It's not too early. We are expecting to see a mix of COVID and ILI infections this year, along with all of the other upper respiratory viral infections that we see during flu season. Rhinovirus, enterovirus, RSVs, other coronaviruses, that sort of thing. So we will, it's going to be interesting to see what happens this year with the mix. A couple of things that we have to help. One is wearing the mask mandate. The same things that protect you from COVID protect you from influenza and all those other respiratory viruses that I just mentioned. So we may see less flu because more people are wearing masks and washing their hands and physical distancing. But we just don't know what to expect. So please get a flu vaccine, continuing doing the things that you need to do to protect yourself from viral infections. Wear a face covering, stay 6 feet away from people who don't live in your household, cover your cough, stay at home if you're sick, wash your hands, don't touch your eye, nose, or mouth, disinfect frequently touch surfaces frequently, high touch surfaces frequently. The other thing that we can do to combat not just respiratory infections, but all infectious diseases and even chronic diseases, or protect yourself from injury, is to maintain a healthy lifestyle. So please, diet and exercise is important. Drinking plenty of water is important. Eating a balanced diet is important. All of those things that help you maintain a healthy lifestyle. Taking vitamin supplements if that's something that helps you feel better or gives you an immunity boost. Those things are sometimes helpful. So all of those things are still really important in maintaining a healthy lifestyle and keeping a healthy immune system, so that if you do become infected with a virus or a bacteria, that your body can help fight that off for you. So I just want to also mention the symptoms of COVID. So the list has expanded over time, and we need to revisit these maybe more often. So fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So if you have any one of those symptoms, get a COVID test. You can get tested at no charge to you at the Mobile County Health Department. Get an appointment by dialing 690-8889. But if you have any of the symptoms, we strongly recommend you get a COVID test. And again, at no cost to the patient. There's still plenty of testing out there, and we want everyone who needs a COVID test to get tested. And if you want a COVID test, you can get tested. So there's plenty of capacity out there. A couple other things I'll just mention in closing. We're going into the fall season here, and throughout the outbreak, there have been different things at different times that have kept me up at night. Early on, it was nursing home outbreaks, and then it's not available, the fact that testing is not available. And every couple of weeks, it seemed like we got into a new sort of topic that would become really important issues, and we'd work, really steady on them and get that one kind of solved and buttoned up, and then move on to something else. The things that we're really keeping an eye on right now are the impact of schools, the impact that reopening schools are having on our COVID outbreak. Again, children and college-aged kids will have, no symptoms or mild symptoms if they get COVID, but the data have shown that when the outbreak, when COVID starts being transmitted among those populations at a really high rate, that you usually see it spill over into the older age categories about 8 days later. So please remember that people that don't live in your household, you should protect your vulnerable populations, your vulnerable family members. Those older folks are the ones who have underlying medical conditions. We also are keeping an eye on the impact of youth and adult sports on our pandemic, our COVID-19 pandemic. And then another thing that we're spending a lot of energy on right now is really trying to wrap our heads around how surveillance for COVID-19 is affected or is being impacted by the increasing availability of rapid tests. So, in the start, we didn't have enough testing. Then it took too long to get a test result back. Then we sort of got to what we thought was kind of a steady state. And now we're at a situation where there are so many rapid test kits coming out, so many rapid tests coming on the market, that the market is going to be flooded with rapid tests. They may be done at doctor's offices, at urgent cares, who knows, maybe even in your school eventually. Lots of talk about these millions and millions of rapid tests that the White House is getting ready to distribute. I heard some figure like Alabama is going to get 1.5 million rapid tests from the White House in the next 90 days or something like that. Just extraordinarily crazy. So we're just trying to figure out sort of, we want everybody to get tested. We love that there's enough tests out there and that people can get a rapid test that doesn't take 2 or 3 or 7 days anymore. But for public health, it's a little bit, like I said, it kind of keeps me up at night trying to figure out how we're going to handle traditional public health surveillance, case investigation, contact tracing, outbreak investigation in the context of, basically something that, is similar to a pregnancy test for COVID-19 that, can be done very easily in a doctor's office. So with that, I will end our COVID update for today, and we will talk to you all again on Monday. So be safe out there. Have a great weekend.